Well, the patients will often come in reporting double vision, even occasionally or intermittently,
Mm-hmm.
blurred vision and difficulty holding focus. Sometimes when they're reading, they actually see words appearing to move on the page. They can be light sensitive. One of my favorite questions is to ask them, what's it like when you're in a busy, crowded environment? Or sometimes what I say to them is, what is it like when you go to a supermarket at 5 o'clock and there's lots of people walking around? And one of the answers that I frequently get back from patients with tick-borne infection is, oh, doctor, I don't go shopping in a supermarket at 5 o'clock. So I said, well, how do you get your food? When do you go? And they say, a lot of them say they set their alarm clock for 2 or 3 o'clock in the morning so they can go to a supermarket in the middle of the night when there's no movement in their peripheral vision, and they can shop and concentrate because the visual processing problem can't organize any type of movement in the peripheral vision. And that same visual processing dysfunction often causes something called a visual midline shift. It's one of the syndromes that I discovered. And that's what causes a person to misalign their body in relationship to gravity. So they may appear clumsy or drift when they're walking, or report that they're having balance problems and they feel unsteady, constantly bumping into door jambs and furniture.
Yeah, that's a common presentation. Yes.
Yeah, these are the typical type of symptoms that patients have. So they go into their conventional doctors and they say, I'm having problems with my balance. The doctors send them over to vestibular specialists or to neurologists, and they miss again the potential for determining Lyme disease.